Okay. Yes.
Yes, sir, we can start.
Yeah, we can start.
Okay. A very good evening and a warm welcome to everyone who has joined us today. I, Anjali, on behalf of Saffron Formulations, welcome all of you to the Renal Talk Dialogue with Proficient Nephrologist. March is the Kidney Awareness Month, and we have our upcoming World Kidney Day, which is on 9th of March. With this, we try to bring awareness on kidney health through our clinical expert. So today, with immense pleasure, I would like to welcome our clinical expert for the day, Dr. Arun Kumar Saab, who is a consultant nephrologist and kidney transplant physician at Apex Multi-Speciality Hospital, Bareilly. Sir, I would like you to welcome you and also try address the audience about the kidney health, and we will have a interaction wherein we will address different types of kidney disease, the stages of it, and how can we address and prevent it during the course of time.
Okay. Thank you for welcoming me, and I think we can go ahead to take the questions from the audience, and I'll be happy to answer them. And
Sure.
if some of the audience is comfortable with Hindi or they can understand Hindi, we can take the questions as well as the answers in Hindi. Okay.
Definitely.
Yeah.
Okay. So to start with, we will, initiate the discussion to a very basic thing, because now, as you know, sir, that today general public is not much aware about what kidney health is.
Yeah.
So we should firstly understand how the kidneys work and how important it is to keep our kidneys very healthy. So if you can just throw a light on what the kidney function is and importance of kidney health.
Yeah. Many people are curious to know, and many are actually not aware that what are kidneys and where are they situated and how many kidneys do we have. So we have a pair of kidneys in most of us, which is situated at the lower back towards the and it's about the size of our fist, and the length of that organ is approximately between 9 to 12 centimeter in most of the adults, and their basic function is to clear out the metabolic and waste products from body, which contains various types of acids which form in the body, the various products, urine products which are related to urea and creatinine, maintenance of homeostasis of water and salt in the body, and removal of carbonic acid, which again accumulates as a part of normal metabolism in the body. So, and if we go in the simple layman language, we can say that the kidneys basically function to keep our water and salt balance in a proper state, to remove the toxic metabolic products along with the lungs from our body, and they have one more role of making red blood cells, that is making blood along with the help of the bones. So these are the main function of our organ, which is present in a pair in us. Yeah.
So this brings me up to a very important question, that you spoke about the important functions of the kidney. But how can one know that whether their kidneys are healthy or not?
Yeah. So two things are there. When a patient should approach a doctor or his treating physician or a general practitioner to know whether he has kidney disease or not. And another aspect is, what are the common tests and advanced tests which are used to assess the kidney function. So when someone has some of the symptoms, like when the patient, when someone has swelling over the face, swelling over the feet, generalized body swelling, when there is breathlessness, that is while lying down or on walking, when a patient has low urine output, when someone has decreased appetite, has decreased tendency to take food, when has recurrent nausea and vomiting, and these are some of the features which may indicate that the person may be suffering from a kidney disease. And apart from this, if some of the risk factors which are commonly associated in our most of the patients, that is which forms, we know that the diabetes and hypertension, that is high blood pressure and increased blood sugar. So these patients form almost 60% of our our patients in our day-to-day OPD and IPD practice. So these are the basic risk factors along with patients who have been on long term of painkillers, in which medical terms we say that NSAIDs, and native drugs, which are available in various forms, under various name and various garbs and forms, which many people take it for day to day or for chronic illnesses, which unknowingly they will not be knowing that it's causing a harm to their kidneys and liver. So the patients who have a risk factor with diabetes, hypertension, on long-term painkillers, on native drugs, along with these symptoms which I just now described, may indicate that the patient may be having kidney disease. And when you contact your treating physician or a doctor, to your family physician, to say that I want to get tested to see if my kidneys are functioning well or not. So the tests which are advised commonly is blood urea, serum creatinine, urine routine microscopy, ultrasound of the abdomen, or ultrasound of the kidneys. And these are the simple tests initially for screening purposes in a patient who is suspected to have a kidney disease, and which rules out most of the kidney diseases. And there are some more advanced nuclear tests which can be done to exactly assess the percentage of kidneys which is functioning, if there are any scars in the kidneys. So these are advanced tests which are not available at most of the routine centers, and which are advised usually taking in view of the patient's symptoms as well as the results from the initial or basic investigations done. Yeah, we can go to the next.
Yes, sir. Thank you so much for a comprehensive detail about the various tests. Sir, I would like you to throw a light on what routine should one follow to keep the kidney health proper. Like, for all of us who are working, as well as those who have been, continuously involved into traveling. So how can they manage their kidney health?
Yeah. A person who doesn't have as such any of the risk factors, a general person, what I've already elaborated, the same thing can be told in a different way, saying that avoid the painkiller drugs unnecessarily without getting it prescribed or without consulting a doctor. Avoid use of native drugs. If you are a hypertensive, keep your blood pressure well under control. If you are a diabetic, keep your blood sugars well under control. And whether many people will sometimes ask what is the correct amount of water that should be taken, whether we should take more water, whether we should restrict water. So the amount of water we always advise patients based on what is the volume status, that is what is the stage of the kidney disease the patient is having, or whether he is free from any kidney disease. So in general, when we say a person who is normal, who doesn't have kidney disease, we should have at least that much intake of water, so that the urine which one passes is nearly colorless or light yellow in color. So that will guide you approximately, depending on how much sweating you do and what is the weather. Depending on that will approximately the color of the urine will guide how much water intake is adequate for you. And God has already made us a body in such a way that it always has that tendency to ask for the amount of water which is deficit in the body. So that gives a good rough. And we know that other risk factors have to be avoided, so that and over the counter painkillers are one of the most common and notorious reasons, and that's why most of the countries, most of the big cities and pharmas, they always avoid giving these painkillers over the counter, and they should always be regulated.
Okay, sir. So any lifestyle modifications that you recommend to patients to keep their kidneys healthy?
Yeah, as we know, for any other metabolic disorders like hypertension, diabetes, the same applies for even kidney disease. We say that you keep your body health, your body weight in control, with BMI less than, preferably within 25 kg per meter square, and keep your metabolic parameters within normal. Have some physical activity. Keep a control on your diet, where we advise in generally for the diabetics and hypertensive. The same thing applies here, of taking a low fat diet, low salt diet, as far as possible vegetarian diet. So these are the things which have to be kept in mind.
Correct, sir.
Yeah.
And sir, the person who has already been into the kidney disease. So if you can just explain like what are the different stages of kidney disease and how one can, at every stage can control the progression of that particular stage.
Yeah. What I would like to stress is kidney. When we say use the word kidney failure, maybe in a layman's language we can explain it as being called as kidney attack. Just like heart attack, we can say that patient had a heart attack, patient had a kidney attack. So this kidney attack or kidney injury can be either acute or chronic. So acute kidney injury, it means that the damage to the kidney has been recent, a short term, and probably it might be reversible. And a chronic kidney disease means a long-standing kidney disease which has been there for a quite long time. And if we go by the definition, so any abnormality in the kidneys which has been there for more than 3 months is called a chronic kidney disease. So acute kidney injury, when we say the acute renal failure or acute kidney injury, when we use this term, it is for usually those conditions of the kidney which might be reversible, which need a different set of treatment, but they still but they may still need sometimes along with other drugs and other treatment may need dialysis. And chronic kidney disease is divided into 5 stages as and when the kidney disease progresses. It is from 1 to 5. It is usually recommended that by the time a person reaches CKD stage 3, where the function of the kidney is goes below 60, we can say that in terms of GFR, we say that 60 ml per minute per 1.73 meter body square. That is the definition. So with that, if the kidney function goes beyond a certain point, then you have to consult a nephrologist early, not when you are at the verge of requiring dialysis or when you have been advised kidney transplant. So an early referral, timely referral from your family physician is must when a patient who has chronic kidney disease. Acute kidney injury, obviously, depending on what are the etiology and your treating physician, he may refer you timely that when something needs a more and a better expert management under a nephrologist, that is when your treating doctor will refer you to a nephrologist. So in general, we say that dietary restrictions are more or less the same, but one rule doesn't apply to everyone. We say that you have to cut out your calories intake. We have to minimize non-vegetarian intake. We have to decrease the salt intake. And once the patient reaches advanced stages of CKD or a patient who is on dialysis or nearing dialysis, some patients will have high potassium levels. So to counteract these high potassium levels and to keep them well under control, along with other measures, you may need some specific dietary measures, which includes avoiding fruit juices and avoiding citrus fruits and avoiding tender coconut water, naril pani. So these are things which have to be avoided to avoid having a high potassium diet. And recently there has been one more fad among the so-called affluent class of people who have been going after a salt which is low salt diet or low sodium diet, which many people have been taking. It's very costly, and I don't think it's a safe thing to take unless your physician advises it, because what happens in that salt is actually the sodium is replaced by the potassium. But since our kidney patients, they retain potassium in a high level, it becomes very dangerous for them. And we have seen patients getting admitted having with complete heart blocks and have to get admitted intensive care units, have to get pacemaker put and undergo dialysis. Many of such patients turn out to be have been taking such type of salts. So these type of salts, if you want to take a salt which is not usually in the routine, apart from the iodized salt, normal iodized salt, you should always consult your treating doctor. Okay. Yeah.
Okay, sir. So for the dialysis patients, do you recommend a low protein diet or a restricted protein diet?
See, regarding the protein intake, yeah, that is an important aspect which we can cover it in, which we should cover it in two parts. One is a patient who is yet to go on dialysis or he is not on dialysis. and another group is patient who is on dialysis. So those patients who are at present on conservative treatment and are not on dialysis, we advise them to have a normal protein intake. In Western countries where the protein intake is very, very high in their diet, they are advised a lower protein intake. But since in our country, when we see that the per kg protein intake is less than usually 1 gram, we usually don't advise. Presently, the nephrologists do not advise any restriction in the protein intake. And once the patient goes on dialysis because of the poor intake, because of the chronic inflammation, and because of the various factors which lead to low protein or albumin levels, these patients are advised a higher dose of protein. So what do we say? You usually advise them approximately 20% more intake of protein. So in a normal 60 kg person who would be usually advised to take 60 gram of protein, the patient who has gone on now on dialysis, there we advise another 20% extra. That is, he will be advised to ideally take 72 grams of protein per day, a high biological value protein, which includes egg white, fish, or in vegetarians, it can include dals, all type of pulses, paneer, soybean, these things.
Yeah. Okay, sir. Sir, and for the dialysis patients, since there is a gap between the two dialysis, so there must be a lot of accumulation of the toxins. So for them, what advice would you recommend to, just balance the toxin level on their body?
Yeah, the patient who has been advised to be on regular dialysis, they should know that once a patient has reached stage 5 or end stage renal disease of CKD, chronic kidney disease, he has to be on regular dialysis. Regular dialysis doesn't mean dialysis once in 7 days or 10 days, but it means at least 3 sessions of dialysis per week, and each lasting for at least 4 hours. So an average adult person usually requires 12 hours of dialysis per week, and that is how the regimen should be. It shouldn't be like the patient should decide as per his convenience or other things, because when we see a normal person, their kidneys function every second, every minute, and that's why we are in a healthy condition. But these patients, we are trying to replace their kidney function artificially by using the various machines, that is the hemodialysis machine. So with this machine, it is always recommended to have at least 4 hours of dialysis, at least 3 times a week. There may be a few exceptions where a person may be having a slightly good urine output or a relatively well-preserved kidney function, where the kidney function might be slightly more than 10%, maybe between 10 to 15%, where in consultation with your nephrologist, maybe you can reduce the frequency of dialysis to hemodialysis to 2 times per week from the usual 3 times.
Okay, sir. And sir, any special recommendation for the patients who have CKD associated with diabetes and cardiovascular disease?
Yeah, there is always there is a close association between kidney disease and heart diseases. We have a condition or a syndrome called cardiorenal syndrome or cardiorenal anemia syndrome, CRS. So this means that a patient who is a patient of chronic kidney disease has a high risk of developing a cardiac problem, and it's a known fact that more than 50% mortality, that is deaths in CKD patients, is due to cardiac causes. So obviously the cardiac causes have to be worked up, and a patient who is of kidney disease has to be well screened for all diseases related to heart that your treating doctor, your nephrologist may advise, and sometimes he may refer you to a cardiologist. So that has to be done sincerely, and it has to be diligently followed, so that the various outcomes related to your cardiac disease, which many times remain undiagnosed, are well taken care of in advance.
Okay, sir. So now this brings me to the end of the session, and this I would like you to address in Hindi to our general public, a key take-home message on the World Kidney Day, on anything that you would like to add as a message to our patients as well as the general public.
Yeah. So देखिए, इस बार हर साल जो है विश्व गुर्दा दिवस या वर्ल्ड किडनी डे जो है हर साल के मार्च के दूसरे थर्सडे को मनाया जाता है, दूसरे गुरुवार को मनाया जाता है। इस बार ये जो है 9 मार्च को मनाया जा रहा है, और इस बार इसका थीम है किडनी हेल्थ फॉर ऑल, यानी कि गुर्दे का स्वास्थ्य सभी के लिए इर्रेस्पेक्टिव ऑफ, यानी कि इसको देखे बिना कि कौन इसको अफोर्ड कर सकता है, कौन इसको ले सकता है, कौन नहीं ले सकता है, और बिना किसी और तरह के भेदभाव के, यानी कि गुर्दे का स्वास्थ्य, गुर्दे से संबंधित सभी इलाज और डायलिसिस, गुर्दा प्रत्यारोपण, ट्रांसप्लांट, ये सभी वर्गों, सभी लोगों के लिए एक समान रूप से अवेलेबल हो, ये इस बार का थीम हमारा रखा गया है। तो इस विश्व गुर्दा दिवस पे मैं सब लोगों को यही मैं मैसेज देना चाहूंगा, यही संदेश देना चाहूंगा कि बचाव ही सबसे सबसे बड़ा मूल मंत्र है इस बीमारी का। और इससे बचने के लिए जरूरी है कि आप देसी दवाइयों से दूर रहें, घर की दवाइयों से दूर रहें। जो मरीज शुगर और ब्लड प्रेशर के हैं वो इसे अच्छे से नियंत्रण में रखें, शुगर को कंट्रोल में रखें, ब्लड प्रेशर को कंट्रोल में रखें। और जो भी 30 के ऊपर 30+ जो भी आप और आपके घर में लोग हैं, उनका साल में एक बार ब्लड प्रेशर और शुगर जरूर चेक करवाएं। अगर कुछ एबनॉर्मल निकल रहा है तो समय रहते हम उसे हैंडल कर सकते हैं, उसे कंट्रोल कर सकते हैं। और आखिर में मैं ये बोलना चाहूंगा कि जनरल पब्लिक के बीच में जो मिसकंसेप्शन है डायलिसिस को लेके, कि डायलिसिस एक बार होगी, हमेशा होगी, डायलिसिस नहीं करवाना चाहिए, तो ये गलत धारणाओं को हमें पार जाना होगा। आप अपने डॉक्टर पर विश्वास रखिए। और डायलिसिस एक वो प्रक्रिया है जब गुर्दे का काम जो है मशीन के द्वारा लिया जाता है, जिससे कि आप एक लगभग नॉर्मल जिंदगी जी सकते हैं। आपको ये जानकर हैरानी होगी कि शरीर में गुर्दा ही एकमात्र ऐसा अंग है जो अगर 100% फेल हो जाए, 100% अगर काम करना बंद कर दे, तो भी कई सालों तक मरीज डायलिसिस के सहारे पर, कोई व्यक्ति जो डायलिसिस के सहारे जो है कई वर्षों तक लगभग नॉर्मल जिंदगी जी सकता है। उसके अलावा शरीर में ऐसा कोई अंग नहीं है जो 100% फेल हो जाए और मरीज बिना किसी परेशानी के अपनी नॉर्मल जिंदगी जी सके, या उसे किसी भी तरह से कृत्रिम रूप से किसी मशीन द्वारा उसे रिप्लेस किया सके। और अगर हम ट्रांसप्लांट की बात करें तो किडनी ही एकमात्र ऐसा अंग है, किडनी ऐसा अंग है जिसका प्रत्यारोपण, जिसका ट्रांसप्लांट जो है सबसे सक्सेसफुल रहा है। सबसे पहले ट्रांसप्लांट भी किडनी के ही किए गए हैं, और अभी भी जो ट्रांसप्लांट कहीं पर भी होते हैं, किसी देश में होते हैं, इंडिया में भी होते हैं, उसमें से 80% से अधिक जो है ट्रांसप्लांट किडनी के ही होते हैं। बाकी अंगों के प्रत्यारोपण ज्यादा जटिल, ज्यादा महंगे, और इनके आउटकम्स उतने बढ़िया नहीं होते हैं। और जब भी लगे कि कोई मरीज अब डायलिसिस पे नियमित है, जो पेशेंट क्रॉनिक किडनी डिजीज का है, तो हम उनको ये कहते हैं कि हम उनको काउंसिल करते हैं कि आप गुर्दा प्रत्यारोपण की ओर जाइए रादर के डायलिसिस पे रहने के। क्योंकि भले ही हम शुरुआत में देखें कि खर्चे इसके ज्यादा हैं, गुर्दा प्रत्यारोपण के शुरुआती खर्चे ज्यादा हैं, लेकिन जब हम 2 साल के खर्चे जोड़ते हैं तो हमें पता चलता है कि खर्चा डायलिसिस पे रहने का और गुर्दा प्रत्यारोपण का बराबर हो जाता है। और 2 साल पूरा होने के बाद इसके खर्चे जो हैं फिर बहुत कम हो जाते हैं गुर्दा प्रत्यारोपण के। और इसके सक्सेस रेट जो है किडनी ट्रांसप्लांट के मोर देन 95% है। आप इसको कुछ इस तरह समझिए कि आज अगर 100 पेशेंट जो डायलिसिस पे हैं, वो अगर हम 5 साल बाद देखते हैं तो संभवतः उसमें से लगभग 50% ही जिंदा होंगे या ठीक चलते होंगे। और आज अगर 100 मरीज गुर्दा प्रत्यारोपित होते हैं या ट्रांसप्लांट करवाते हैं, तो आज से 5 साल बाद हम उनमें से देखेंगे कि 85% लोग लगभग ठीक चल रहे होंगे, दवाइयों पे चल रहे होंगे, जो हमें ठीक मिलेंगे। तो इस तरह से आप इसको समझ सकते हैं कि कितना फर्क है इसमें। तो जो भी ये सोचकर चलें कि नहीं हमें ये नहीं करवाना है डायलिसिस, या हमें नहीं कराना है गुर्दा प्रत्यारोपण, तो एक बार अपने डॉक्टर से मिले और अपनी सारी जो मन में जो शंका है उसको जरूर दूर करें। डायलिसिस आने का मतलब ये नहीं कि जिंदगी खत्म हो गई है। इस पे भी रहते हुए आप सालों साल, 15 साल, 20 साल, 25 साल और बहुत लंबा आप चल सकते हैं। जी,
थैंक यू सो मच सर। आपने सारी चीजें हाईलाइट कर ली, द रिस्क फैक्टर्स, स्पेशली आप लाइफस्टाइल कैसे मॉडिफाई कर सकते हो, किडनी डिसीज कैसे मैनेज करना है, और दूसरी बहुत इंपॉर्टेंट चीज, फॉर द पीपल हु आर ऑलरेडी ऑन किडनी डिसीज, हाउ कैन दे मेक देयर लाइफ बेटर and not to avoid dialysis and kidney transplant and consult the doctor timely for the same. Thank you so much sir for your time and a wonderful and a very outstanding deliberation. I'm sure our audience will take key messages from here and will also incorporate in their day-to-day routine. Thank you so much sir for joining us today. We look forward to your support and guidance throughout. Thank you so much.
thank you.